Hi, my name is Paul Braun, and I'm the training specialist with Advantage Treatment Centers. Thank you for joining me as we discuss recognizing and spotting drugs and drug use in our facilities. This presentation will include some of the more common drugs, but not all drugs, that you may run into on your sites. It includes what the substance looks like, what it does to the individual using it, and what the person looks like and acts like when they are under the influence of these substances. It is important to remember that our safety as staff, our client's safety, and our community's safety is our primary concern. Some important steps to remember when encountering illegal substances is to keep yourself safe at all times. Observe for signs of impairment, document substances location, observable signs and symptoms of use, and report these to a supervisor. And if emergency exists, call 911. Do not touch suspected drugs directly, as some substances can be absorbed through the skin, putting you at risk. Secure the scene and preserve evidence, and if you suspect drugs are in a person's possession or that a person is under the influence of an illegal substance, do not confront or search them alone if at all possible. Let's talk about what to do when use is expected. Look at the individual. Watch their eyes, their balance, and skin. Look for profuse sweating, visible shakes, or nodding off behaviors. Pay attention to if they have on them or in their vicinity any small bags, bottles, pipes, syringes, or foil. Listen to the person for slurred or rapid speech, them repeating the same story or details, unusual smells on their clothing or breath. And if you do detect anything abnormal in their behavior or appearance, write it down. Document the facts and items, not opinions or beliefs. Report any and all discoveries or signs of impairment to your supervisor right away. And again, if it is a medical emergency, contact 911. Methamphetamine is a common substance that is misused by clients in our field. They can also refer to it as crystal, ice, glass, tina, or crank. This substance is an upper, meaning that it speeds the person up. It can be identified as clear or cloudy chunks that look like broke glass or rock candy. Its coloring can be white, off-white, brown, or pinkish powder. It can also be as a pressed pill that looks like fake or homemade and is often found with glass pipes, lighters, small baggies, or foil. Meth can be smoked, snorted, swallowed, or injected, and when it kicks in, uh, it's just within a few minutes of use. A high from meth can last anywhere between 6 to 12 hours. These are some, but not all of the common ways it can be seen when it is prepared for use by an individual. Always remember that if you do need to handle drugs or paraphernalia as a way to secure it, that you photo document the location and how it was found, and that you do not handle unknown powders, needles, or paraphernalia with your bare hands. Always use gloves. Leave it in place and secure the area if possible. Never leave it unattended. Contact your supervisor or law enforcement and have another staff with you if at all possible. In the case of an overdose, call 911. If you suspect that someone has been using meth, some signs include having big pupils, sweaty skin, fast or nonstop speech. They seem wired or paranoid, and you detect a chemical or sour smell from them. Grinding teeth, picking at their skin, or constant fidgeting. There are some differences between one-time use and long-term use. One-time use signs include heavy sweating, even if the temperature is not high, large pupils that do not shrink in bright light, racing heart, shaky hands or jittery movements, and they may remain awake for many hours as well as not eat anything. Long-term use of meth is usually identified by severely decaying or missing teeth, open sores or scabs on their face and arms, aged skin and severe weight loss, along with ongoing paranoia, memory loss, and hearing voices. Here are some of the signs that we discussed and what they look like when a person is under the influence of methamphetamine. Remember to document what you saw, where and when, take pictures if possible, and always ensure your safety, as individuals in a paranoid state are unpredictable and may exhibit signs of aggression or become combative when confronted. Cocaine is another substance that we may encounter or hear about. It can also be called coke, blow, snow, or crack, which refers to the smokable rock form of cocaine. Cocaine is also an upper, which means it speeds the user up. Cocaine is generally a fine white powder, often found in small Ziploc baggies or paper foils. It can also be an off-white or yellowish chunks or rocks. Cocaine can be snorted, smoked, or injected. When smoked or injected, it takes effect in seconds, and when snorted, within minutes. The high can typically last between 30 to 90 minutes. Here are some different ways you may see cocaine if it's being set up just before use, uh, if it's going to be snorted, smoked, or injected. Remember, secure the scene, notify supervisors or law enforcement, document evidence, and in the case of an overdose, call 911. One substance that you may be very familiar with already is marijuana, also known as weed, pot, bud, flower, dab, or edibles. It can also be used in vapes. Marijuana is a relaxant, meaning that it slows an individual down and alters their senses. Marijuana is dried, greenish-brown buds with a strong skunk-like smell. It can also be a sticky brownish gold in its concentrate form for dabs. It can be very difficult to recognize as it can be baked into foods, dissolved in drinks, or made into gummies. Marijuana can be smoked, vaped, or eaten. When smoked, the high kicks in within minutes, and when consumed as edibles, kicks in within 30 minutes to 2 hours. There are some different ways you might see marijuana prepared for use, and with Colorado laws on recreational use and medicinal use, marijuana is easily accessible to our clients and communities in many different forms. Marijuana is detectable in urinalysis longer than other substances and can be detected 2 to 4 weeks after use. Signs of use include behaviors like slow to respond and laugh at small things and can have a glazed or far off look and bloodshot eyes. Marijuana makes people often forget to the point that they lose their train of thought mid-sentence. They often get very hungry or are eating constantly and can produce a state of anxiousness or paranoia. Signs after one use include bloodshot eyes, dry mouth, or constantly drinking water or licking their lips, a skunky smell about them and slow reactions, fumbling movements and slow speech, and then long-term abuse adds a chronic dry cough, yellowed fingertips, severe vomiting, and memory and motivation problems, along with trouble focusing. Some images of things that might be indicators of use or that someone is about to use. Marijuana is almost impossible to overdose on, but can cause severe impairment with heavy use. If use is found or items of marijuana is found, be sure to document and preserve evidence and notify supervisors. If marijuana is found, even though it is legal for use in Colorado, it is still a crime in a correctional facility and law enforcement needs to be notified. Alcohol is a substance that most of society is familiar with and comes in many different forms and strengths. These include beer, wine, liquor or spirits, Alcohol is a relaxant that slows a person down, and while is usually containers are easily recognizable, alcohol can be hidden in many common items such as water bottles, flasks, coffee cups, sports drinks, or vape juice. In some cases, due to misuse, items such as hand sanitizer or mouthwash can be consumed for the effects of the alcohol content in them. Alcohol is almost always drank, but can be ingested rectally for faster absorption and more intense effects. When drank, effects start within 10 to 30 minutes and can continue to build over 1 to 2 hours. While generally higher concentrations of alcohol, such as liquor, can get quick drunk effects with smaller doses, other forms of alcohol, such as beer, usually require larger volumes over longer periods of time to achieve the same level of impairment. Alcohol can be mixed into any liquid for smuggling purposes, and that can make it very difficult to detect. Signs of alcohol use includes slurred or sloppy speech and repeating themselves. People under the influence of alcohol can be loud and boisterous, overly friendly, and be very quick to anger and become violent. Often they can lose their balance easily and stumble or sway, falling or use walls or furniture for support. And they smell distinctly of alcohol. They get red in the face, bloodshot eyes, have poor balance, and can vomit. Long-term use can create a permanent facial redness, a yellow tint to the whites of their eyes or skin, indicating liver damage, a swollen belly, or excessive weight gains or weight loss. When not drinking after long-term use, they can get shaky hands, sweats, even in cool areas, and withdrawal from severe long-term use can be fatal and may require medical attention. Alcohol can be overused, leading to alcohol poisoning. If alcohol poisoning is suspected, call 911 immediately. Suboxone is a substance that is used to treat opioid addiction and is common in our facilities as a prescription medication. Despite its positive medication uses, Suboxone can also be misused as a street drug and can be referred to as subs, strips, bupe, or film. They are small orange rectangular film strips that are placed under the tongue to dissolve, or are small orange six-sided pills marked with N8 or N2 that is supposed to be placed under the tongue to dissolve. When being misused, pills are sometimes crushed and snorted. When ingested, the effects kick in over 30 minutes to 1 hour, and the effects will last most of the day. When someone is under the influence of Suboxone, they can act calm, sleepy, and have sluggish responses, but are usually coherent. The person may seem fine if the person is using Suboxone as prescribed for addiction treatment, but misuse can cause nodding off or mild confusion. Use can cause small pupils, slow, calm movements, nausea, headache, or stomach complaints, and low energy as if mildly sedated. Long-term use can cause dental decay, chronic constipation, low energy, depression, and withdrawal symptoms if they miss doses. Because of its potential for misuse, it must be highly monitored. Suboxone overdose is difficult to achieve because it also includes naloxone in it, which is used to treat opioid overdosing. If someone does overdose, it can look like respiratory depression, and 911 should be contacted right away. Benzodiazepines, or referred to as benzos, bars, Xanax, Z-bars, football, Valium, or K-pens, are a relaxant that slows people down. Think of it like alcohol in a pill form. They come in many different pill forms via prescription medication, as well as counterfeit pills, which are often laced with fentanyl. Benzodiazepines are either swallowed or crushed and snorted, and the effects begin in 15 minutes to 1 hour and can last for several hours. Benzodiazepines are medically prescribed for treatments of severe anxiety, panic disorders, insomnia, seizures, and alcohol withdrawals. This makes them widely available for misuse. Signs of use will include acting drunk without the smell of alcohol, slurring their speech, stumbling, falling and knocking things over, as well as falling asleep mid-task. Overdose on benzodiazepines present as profound sedation, extreme drowsiness, limp muscles, slowed or shallow breathing, bluish lips or fingernails, or coma. These risks increase if it has been taken in combination with other substances. If you suspect someone has overdosed, contact 911 immediately. Opioids are broken into three categories: natural opiates, such as morphine, codeine, and opium; semi-synthetic opiates, such as oxycodone, hydromorphone, hydrocodone, and heroin; and fully synthetic opioids like fentanyl, tramadol, and methadone. Opioids can be referred to on the street as dope, smack, H, blues, M30s, or China white. Opioids provide medicinal use as an extreme relaxant, but that also creates a strong overdose risk potential. Opioids can be injected, snorted, smoked, or swallowed. When injected or smoked, the effects hit in seconds, and when snorted, effects begin in minutes. Opioids are often found when being misused with aluminum foil, syringes, cotton balls, spoons, or as a pill of many different colors and shapes. Some opioids can absorb through the skin, so never handle without protective gloves, or if possible, secure the area and let law enforcement collect it. Someone using opioids display behaviors such as nodding off when and then jolting awake, mumbling or hard to understand speech, scratching of face and arms, and are very slow to respond. They will have tiny pinpoint pupils, slow breathing, blue lips or fingertips, fresh needle marks or bruises, and in the case of an overdose, will not be breathing. Call 911 if an overdose is suspected, and give Narcan if trained to do so. Due to its extreme relaxant effect and extreme addiction potential, opioids are one of the state's highest misused substances, and its misuse has become an epidemic throughout the state. Inhalants and solvents are inhaled chemicals that are often misused due to their easy availability in most common stores and because they provide a quick high. But that high only lasts a few minutes, which leads to frequent reuse in one setting and can lead to a higher probability of sudden death risk. Inhalants or solvents can be misused in a variety of different ways, from sniffing a soaked rag to balloons filled with gas, straight from a bottle, from any compressed air can, a marker, or a glue bottle. When used, it causes an individual to act drunk or dizzy, but with no alcohol smell, giggling or dazed with slurred speech, confusion, loss of balance, mood swings, and can sometimes be aggressive when coming down off the inhalant. They can have a strong chemical smell on their breath, clothes, or hands, runny noses or nosebleeds, paint or chemical stains around the mouth or hands, and sudden cardiac arrest is possible even after just one use. Due to the extreme risk of cardiac arrest and the poisonous nature of chemicals that are used in it as inhalants, if use is known or suspected, Supervisors and 911 should be contacted immediately, and the person using should be taken to a well-ventilated area and closely monitored until emergency services arrive. Substances should only be handled while wearing protective clothing and secured in a sealed plastic bag if possible, or the area evacuated and secured. MDMA, also known as X, E, Molly, rolls, or beans, are an upper that not only speeds them up, but also alters senses. It can be swallowed or snorted and kicks in 30 minutes to an hour after being taken, and its effects last between 3 to 6 hours. MDMAs are usually very colorful pressed pills with stamped logos or loose powder or crystals in a capsule that can be dissolved in a drink or snorted. They are known as a party drug and are very often laced with methamphetamines. Individuals under the influence of MDMAs can become very overly affectionate and keep hugging people, touching faces or clothing. They become very hyper and can't sit still, and they grind their teeth or clench their jaw and become very sensitive to lights, sound, and touch. Signs of use include being big, slow reacting pupils, heavy sweating with skin that is hot to the touch, and they consume lots of water or refuse water and can overheat or faint. MDMA can cause hyperthermia or dangerously high body temperature and increased physical activity that leads to changes in the body's temperature regulating mechanisms. Electrolyte imbalance, kidney failure, dehydration, elevated blood pressure, arrhythmias, and can lead to stroke or heart attack. Intracranial hemorrhage or tearing of the aorta, delirium, or seizures. If use or an overdose is suspected, 911 should be contacted immediately. We've covered some of the more common substances that get abused, but know that there are several others that were not covered in this presentation. As a quick guide reference, here's a short chart that can be used to assist in symptoms and substance recognition. You've probably noticed that several of these substances have similar signs and symptoms, so if in doubt, do not diagnose and leave that part up to medical professionals. If a person states what substance they have used, pass that information along to medical personnel. And remember, if someone is unresponsive, bluing around the lips or fingertips, or is not breathing, call 911 immediately. Treat any substance overdose as life-threatening and always wear protective gear. Thank you for joining me in covering this very important topic of recognizing substances and substance use.